structures related to the cornea, lens, retina, and several accessories, several gadgets, and it is also used for 3D uh, planning of the surgical method and also for teaching. So we are looking at those two parts, teaching and surgical training. An article is there in the Kerala Journal of Ophthalmology by myself and Dr. Anju Kuriakose, where we have discussed all that, and then there are also separate articles on specific objects which we have 3D printed, including a 3D print adapter for smartphone slit lamp photography. One of the main things which in Arvind Pondicherry they designed is the 3D printed eyeball for training purposes, which includes not just a diagnostic evaluation, a 3D printed eyeball with a retina printed inside, attached to a slit lamp for examining, for fundus photography, for laser practice, and so on, indirect ophthalmology practice. It is also used for surgical training as well. And in fact, there is also an indentable model for practicing indirect ophthalmoscopy. This is the indentable model. This is based on a material called TPU, which is flexible. Then, of course, there are commercially available 3D printed eyes. So this is the Bionico models, which you can actually buy and use. These models are available without 3D printing also. They can be injection molded also. That is the one which is available in India. But 3D printed can be customized. So that is one of the advantages of 3D printed model eyes. So this is why another alumni of Arvind Pondicherry, Dr. Prashant Girish, had made this one. I think Dr. Rajesh Vedachalam also is involved in this 3D printed surgical eye from Arvind Pondicherry. And this is from myself, 3D printed glaucoma drainage device, 3D printed CTR, CTS, and all these things are open source and available on this website. So this is thingiverse.com, where you can download and use these 3D printed designs. So these are the 3D printed models of this is of an Orolab aqueous drainage implant, and these are some other models of 3D printed glaucoma drainage devices, and this is a CTR. All these were printed using a resin printer, and the source code is available on Thingiverse. This is another interesting design made with the help of two MBBS students in Ramchandra Medical College, who came to me for a project, and this is what we designed. We designed a punctal plug and 3D printed it using resin. And this is the 3D printed glaucoma drainage device which we practiced implanting on an animal eye, so that will help in GDD surgery training. This video is available on YouTube if you scan this QR code. And of course, 3D printed teaching tools, you can even use it for practicing contact lens fitting. This is by Zhao et al. They used fluorescein dye to check the fitting of contact lens on various astigmatism and irregularly shaped corneas, which were 3D printed after designing on a free software called Tinkercad. This is by our chief instructor, Dr. Prasanna Venkatesh and team. This is the 3D models which they have designed in CAD. And once these models were designed in CAD, they printed it and assembled it and spray painted it to look like this. So this is, I think they will bring this also. This is a 3D printed anatomical model. This is very useful in teaching. And these are the cerebral venous sinuses, again 3D printed. They also have the same 3D models in virtual space as well. You can experience that in the last presentation. There are also 3D printed models for orbit dissection. 3D printed orbit model can be especially useful, and all these are not very expensive. Once the design is available, you print it, the material cost is going to be 200 rupees or so, in that range of price. So don't think that 3D printing is an expensive thing. If you want to design it and you need to get the help of a designer, yes, but the actual material cost is going to be very less. So if you have an idea, you can build on
Dr. John, 1 minute. 1 minute left.
So 3D printed orbit model, you can also plan for radiation treatment by planning the pathways and all that. You can do it with even a software, and this one gives a physical model in your hand which helps us. And there's another interesting use by this particular group, Wu Choi et al., which they 3D printed the 3D model of the OCTs. So this is useful for explaining to the patient as well as for maybe surgical planning as well. So you have vitreomacular traction and a membrane and all that. You print it out, you get the 3D model, you can just show the patient this is what they have. And you can also plan for making instruments such as this. And myself, I use 3D printing to design an instrument called the foldable fundoscope, which is a fundus camera based on a smartphone. And also there is a 3D printed smartphone adapter which we have published in the Kerala Journal of Ophthalmology, 3D printed slit lamp microscope. These are not these are very simple devices which you can download and print. And this is another 3D printed innovation, transconjunctival trocar cannula system, which they designed, printed, and later they converted into a metal model. Even Canabrava's ring was designed in 3D printing first. And of course, you can use personalized 3D printing, and this is a 3D printed implant, and these are all the other things available. I thank all the institutes which have trained me. Thank you.
Thank you, John sir, for this wonderful talk.